Charlotte Ramey. I'm a graduate student at the Eastern Kentucky University Graduate School of Nursing, and this is my YouTube video for presentation for Research 890. My topic of discussion was depression in the elderly. 50% of residents in nursing homes are depressed or have some symptoms of depression, with 35% of all older adults having depression. Most do not receive treatment for various reasons such as medication side effects, cost of medication, the stigma of just mental health alone with the elderly. They were raised in a generation where mental health was not something that you sought treatment for. So most do not receive treatment, or the treatment is sometimes treatment that they do not deem suitable for them for the side effects that the medications do cause. So therefore, I'm looking at some sort of alternative treatment, or a treatment that can be instituted for the older adult that can take place of the antidepressants, something that they feel more adapted to their generation. So my PICO question that I chose to address was, in patients over the age of 65 with a diagnosis of depression, how does physical group exercise or activities compare with antidepressant treatment use, and how does that affect the quality of life within 1 year of diagnosis of depression? To do that, I've done a systematic review of research and literature that is already in print. I used the databases of CINAHL, ProQuest, Medline, and Ovid. With a keyword search for physical activity, depression, older adult, elderly, treatment, I narrowed that down to 4 surveys performed within the last 5 years. 2 of those were systematic reviews of random control trials, and 2 of those were just random control trials on this certain topic. 2 of the studies affected physical exercise and physical activity on depression only, and 1 study addressed physical exercise and physical activity on quality of life, while 1 study looked at both physical exercise and activity on depression. 1 study also included music therapy along with physical exercise on the treatment of depression and quality of life. In those 4 studies that I reviewed, they all had positive effects towards the support of my PICO question. All evidence-based interventions provided look like they would be suitable for nursing care and provide superior care. All articles and all research that was done looked at physical exercise as an intervention, and in that intervention it showed improvement in depression symptoms, a decrease in the geriatric depression scale, as well as improvement in quality of life. The idea with this intervention is an intervention that nurses can do without a specific order from a physician. Exercise or group activity is something that nurses can do alone, as well as interdisciplinary care team members can perform this interaction as well. It can be delegated to unlicensed personnel or physical therapy or speech therapy, group therapy, or some group that they're in. The intervention that I chose to institute this change would be provide at least 30 minutes of physical group exercise 2 times a week, of moderate group physical exercise or activity, providing to the patient 2 times a week with a depression scale or geriatric depression scale of 10 or greater. The environment that I chose to institute this in would be resident care homes, long-term care, or home health, as that seems to be the area where the older adult seems to congregate, and we can have a group together of people that can provide these interventions. Thank you.